We had a lot of preparation to bring my mother home, who was hospitalized for over 6 months.
It was a great feeling to be home again, to be in my own space and sleep in my own bed. That was a big difference, yeah.
But it was overwhelming to discover what the family was responsible to organize and care for with my mother coming home. Going over all of the meds, my responsibilities for filling them, getting med containers, organizing and managing the various VNA nurses that would be coming in and out of the house. It was a lot to digest.
And that is where the First Day Home Care program steps in, seeing patients in their home during that critical first 24 hours.
What it is a program that's designed to help people who are being discharged from the hospital or a skilled nursing facility and do not have a caregiver at home.
The First Day Home program covers patients over 60 living in Cohasset, Hingham, Hull, Norwell, Rockland, Scituate, or Weymouth. During the visit, the nurse will review medication, reinforce the prescribed medical instructions, evaluate living conditions, and make suggestions to improve patient safety. And in some cases, the nurse will arrange to pick up and pre-fill prescriptions and deliver food donated by Panera Bread.
I believe we have made a great impact on many of the patients that we have seen, just in terms of a smooth transition home.
I think when you come home from, whether it's a hospital or rehab situation, you feel, you don't, especially when you live alone, your brain sort of says, oh, I can do this, I can do that. And then when you get home, you say, oops, I don't know, this is not what I thought it was going to be like.
They are either met by the nurse or the nurse is arriving shortly after. For a senior with multiple health problems, in a compromised state, having been in the hospital, the nurse is just able to make their home safer.
Without this program, you'd have more return visits to the hospital, and that's just, obviously it's something you want to avoid. So I can't express enough how important it is to get a nurse to a person on their first day and give them good solid ground to go forward.
And in its first year, the First Day Home Care program was recognized with a Home Care Alliance Innovation Award for addressing this crucial care issue.
Day one is the solution to a lot of our problems with healthcare. A nurse is right there to educate the family and the patient. There's prevention from reoccurrence or re-entry to the hospital, which is super important. Nobody wants to go back to the hospital, especially the elderly. They're most comfortable in their homes.
As the population ages, there's going to be more people living alone. It's very confusing for them to know their medications, to be able to remain safely in the home. So I can certainly see that this is it's a wonderful service for these people.
I think I had a wonderful rehab because of this connection I had. And so that connection to the First Day program, I think, was the thing I needed.
To see a patient a year later, 6 months later, such as Barbara and Rita, is really incredible to see them. It is fulfilling. It is fulfilling.
Chronic disease management and self-management is huge, and that's where we need to get to.
The League looks forward to continuing supporting this program and expanding it to more communities in the area. We have the same mission, and that's to take care of our elderly.